So one of the things we found when we sent patients videos of treatments initially, so we'd send them a video about the treatment initially in the first video campaign, in the first text message, we found that it doesn't really work. And the reason for that is because patients are focused on their problem, not your solution. The fundamental problem with most of marketing today is that we want to push our solutions to them. And the truth to life and anything in patients is nobody cares about your solution. They care about their own problem. And unless you've established that you understand their problem, you're not going to build a connection and a bond of trust with that patient. And so what we do with our Hoot videos, the algorithm of Hoot videos takes into account Don Miller's approach, what we call StoryBrand. Don Miller wrote this amazing book. He's a marketing guru, messaging guru. And he basically says the same thing as human beings walking around with their problems in their head, and they don't care about your solution. What you must do is to talk 75% about the problem and 25% about your solution. And when you do that in the beginning of the video series, you talk about the problem, the disease, the symptoms that the patient might be going through, and the issues they might be struggling with in their having that disease, have that problem. The patient feels as if the doctor understands. The doctor understands what they're going through, and they build a bond and a trust with them of credibility. And then eventually at the end, you can talk about the solution that you have for their problem. But first, you must establish you understand the problem. So our Hoot algorithm, it's the first campaign, the inquiry campaign is about a week, and it's 3 text messages and 1 email, dripped over a couple of days. And what that does is the first 2 or 3 videos are really focused on what is the disease, what happens if you do nothing, a little bit more about the disease and the symptoms, and traditional therapies may be a solution for it. And then finally, the last video is, hey, let me talk to you about what's to expect at the consultation, but also a little bit about some of the treatments that might be available we could talk about at the consultation. And what that does is it drip, 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 problem, and then the solution, and hey, look forward to speaking to you soon. The patient is seeing some of your videos talking about your problem, and they're like, wow, this doctor gets it. They understand what I'm going through. And what that does is builds, again, a bond of trust and credibility, and that allows the patient to see you as someone like, yeah, this doctor understands me, understands my problem. He or she are not trying to push a solution on me. And then I'll come in and I'll book a consultation. And then I'll come in for an evaluation. And then I'll come in, I'll do a phone call, because you've established that trust and that relationship. And that's what our Hoot algorithm is. It's really taking into account the psychology of patients today, which patients are focused on problems. And therefore, our videos are focused on the problem, and then the solution, the treatment. And that is what we found to be very effective at increasing the booking rate, increasing the sign-up rate, increasing the callback rate, ultimately increasing the conversion, helping the patient get onto therapy, and for you, the doctor and the practice, to grow more revenues. This is Bob Migliani. I'm with Hoot. Look forward to speaking to you soon. Thank you.